Hello, my name is Dat Vo. I'm a radiation oncologist here at CancerCARE at Titus Regional Medical Center. Thank you for tuning in. Today, I'm going to give a brief talk on the role of radiation therapy for benign orthopedic conditions. Before we start on the role of radiation for benign orthopedic conditions, I would like to talk a little bit about how radiation therapy is given. As you can see here on the screen, this is a picture of a radiation machine. Commonly we call it a linear accelerator, otherwise known as a LINAC. And typically for patients, they would receive a treatment, and each treatment would last approximately 15 to 30 minutes. Depending on the condition that a patient may have, we may deliver radiation from anywhere from 1 to 44 radiation treatments. And this is a non-invasive treatment. And along that is that for patients, when they get radiation treatments, there's not necessarily any downtime or restrictions while receiving radiation therapy. Radiation therapy is a common treatment that we treat for many different types of medical conditions. And the way that radiation works is that it's a high energy X-ray that is ionizing that we use to treat most commonly for patients with cancer. Here in the United States, there's approximately 1 million people a year that will receive radiation therapy in some form for their treatment of cancer. And the way that radiation works is that it relies on causing DNA damage and other types of cellular damage for its effects. When we deliver radiation therapy, it cannot be felt or seen, and for most patients, they do not have any immediate effects from the radiation itself. However, as we deliver the radiation, the biological effects and the side effects associated with radiation therapy can develop in the days, weeks, and months after the completion of radiation therapy. When we decide to give radiation, what we would need to do first is a planning session. Most commonly, we call that a simulation, and we perform this to help design and map out the radiation treatment. I then work with a physicist and a dosimetrist in the background behind closed doors to design the radiation treatment to treat the area that we intend to treat. And then when we are ready to deliver radiation, it starts approximately 1 week later and is given Monday through Friday, unless otherwise specified. Like I mentioned before, the main use of radiation therapy is the treatment of cancer and other related malignancies. And these are common cancers such as prostate cancer, breast cancer, rectal cancer, and lung cancer, amongst other types of cancers. However, there are indications for benign conditions, that is, things that are not cancer related, such as osteoarthritis and Dupuytren's contracture. The goal of radiation therapy for patients with benign conditions is to either reduce the inflammation associated with these conditions or the proliferation of cells that are involved in these benign conditions. When these conditions develop, many patients can develop pain or limited range of motion that leads to poor quality of life. And radiation therapy has been shown and studied and demonstrated to improve pain and function in patients with benign conditions. Here is a list of different conditions that can be treated with radiation therapy. We usually divide them up into different categories. The first category here is something that we would call a soft tissue or hyperproliferative disorder. These are conditions such as Dupuytren's contracture or Ledderhose disease. A second category of benign conditions that can be treated with radiation therapy are what we would call degenerative bone and joint disorders. These conditions include rotator cuff syndrome, plantar fasciitis, and then osteoarthritis of the joints. There are a variety of other conditions that do not fit into these categories, such as conditions that may affect the eyes from Graves' disease and many, many more. But the question is, why does radiation therapy work for patients with benign conditions? Well, it seems that the biological basis is likely from the effects of radiation on the inflammation or reduction of proliferation that may be involved in these disease processes. There may be other mechanisms involved, but time and time again, there are preclinical and clinical studies that have been performed showing an improvement in pain, range of motion, and quality of life for patients with benign conditions. The first category of diseases that I want to discuss is what we call hyperproliferative diseases. The two most common types that would fit in this category is what we call Dupuytren's disease and Ledderhose disease. These are conditions where it may affect the palm of the hands. We call this Dupuytren's, or the bottom of the feet, which we call letter hose. And typically patients will develop small nodules and cords that over time can limit movement in those joints and those limbs and can cause pain. Across the United States, approximately 1 to 2% of Americans can develop this, with a predilection for patients with Northern European origins. This is an example of what may happen with patients with Dupuytren's contracture. We call this a tabletop test, and what we ask patients to do if they do have Dupuytren's contracture is to put their hand on a tabletop and then try to lay it as flat as possible. For patients that have Dupuytren's contractures, they may develop these nodules and cords that may limit them the ability to keep their hand flat. And you can see here in this particular diagram that this patient right here is not able to put their hand flat on the test, which would be indicative of someone with Dupuytren's contracture. There are a variety of different treatments out there for these conditions. They could be in the form of injection of a solution called collagenase. It could be radiation therapy, as we will talk about, and then there's also hand surgery. There's a couple of things that I need to know. First, there's a lack of high quality data comparing each treatment option. And the treatment choice really depends on where you're at in the condition, that is the stage of your condition, what benefits you can expect from the treatment, what risk may be associated with it, and then what is the overall preference from the patient. When we deliver radiation therapy for patients with Dupuytren and letter hose disease, the goal of treatment is to preserve motion, to preserve the function of the affected hand or feet, and prevent progression of the condition. The ideal patient for radiation therapy is one who is early in the process and has not developed much contracture. That is, they're still able to lay their hand flat on the table in the case of Dupuytren. And typically, we would administer 7 radiation treatments, with each treatment lasting approximately 20 minutes, given Monday through Friday until a patient is done with radiation treatment. Shown here is an example of how we would deliver radiation treatment. So you can see here that on the hand, again, that is considered Dupuytren contracture, or on the feet, considered letter hose disease, we would mark out with a marker where the cords and the nodules may be on the hand. So you can see here that there are a number of different nodules shown here in the circle on the hand and circle on here on the feet, and then some cords shown here in these lines right here. And then this would be the intended area of treatment. We will then block out where we don't want to treat, which is the other parts of the hand, and we would deliver the radiation therapy. And shown here in bold that approximately 90% of patients will have some stabilization of their condition. That is, their condition will not worsen, or will have an improvement in their condition. That is, reduced pain and improved range of motion. Moving on to the next category, which we will call degenerative bone and joint diseases, we're going to start off talking about, well, what conditions we could treat. So as mentioned before, these conditions can include, but it's not limited to, something such as shoulder syndrome, otherwise known as rotator cuff syndrome, plantar fasciitis, golfer's and tennis elbow, and osteoarthritis. And most commonly, we would treat this conservatively, that is with over-the-counter medications, sometimes prescription medications, and then also very commonly, surgical treatments. Rotator cuff syndrome refers to the location of the condition, so of course affecting the shoulders, but most patients would notice that they would have pain, reduced motion, or even difficulty sleeping on that affected shoulder. You can see here, this is an example of what the shoulder may look like. And then shown here on this image right here, that there may be a tear on the rotator cuff that may lead to pain. Plantar fasciitis, otherwise known as heel spur syndrome or painful heel spur, can affect approximately 10% of people in their lifetime. That equates to approximately 2 to 6 million Americans per year. And how patients would present with this is that they may have pain within the first few steps after a period of inactivity. For example, when you wake up in the morning after having a long night's sleep, that there may be difficulties with pain as soon as you step on it. And for most people, the pain will alleviate as soon as you get pressure off your foot. That is when you sit down or you just do something where you're not on the foot so much anymore. And here's an example of what an X-ray and an MRI may look like, where you can see here that there's on the bone that there may be little heel spurs that is right here, and then that itself can cause inflammation that may lead to the pain that we just discussed for patients with plantar fasciitis. Humeral epicondylopathy is also known as golfer's elbow or tennis elbow, and it really depends on where the location of the injury is. And commonly this occurs because people tend to overuse that. That is, if you play a lot of golf or tennis, for example. And it's documented that approximately 50% of patients can develop tennis elbow, which comes out to about 1% of people across the United States. And most common presentation would be pain with use. And so one test that we would ask a patient to do is if they have difficulties when they would, say, turn a key either clockwise with the right hand or turning it counterclockwise, and that would indicate where the pain may be. And here's a MRI example of what this may look like, where you may see that there is inflammation located on one side of your elbow, which may lead to pain. Most commonly, I do want to talk about osteoarthritis. And this is commonly discussed as where there's a gradual loss of cartilage in between the bone. And most commonly, the bones that we talk about shown here on this diagram right here, where it may affect your shoulder, your elbow, your hands, your hip, your knees, and your feet. And so the cartilage in between those two bones may erode as time goes on, leading to bone-on-bone rubbing on one another. It's estimated that anywhere from about 20 million people up to 32 million people in the United States a year are affected by arthritis. And the most common risk factor for it is age. And typically when patients present, they will present with joint pain that is aggravated when you're using it and may be relieved by rest. And so, for example, it may be difficult for patients to stand up or walk up and down the stairs if they have arthritis of the knees, for example, or if it affects their hands, it may be difficult for them to open something, say, like a jar of pickles in the kitchen. And here's a cartoon of what that means. So shown here in this light gray would be the cartilage, but as time goes on, there may be an erosion of the cartilage leading to one part of the bone rubbing on another bone, leading to the inflammation and the pain that's associated with osteoarthritis. The way that radiation works for bone and joint conditions is that there is a low dose radiation therapy that can reduce the inflammation and improve pain, leading to improved quality of life. Typically, we would give 6 low doses of treatment, usually 2 to 3 treatments per week until a patient is done with it, and then we will revisit with the patient and reassess how they respond after approximately 4 months. And shown here on bold, you can see that approximately 75% of patients will have a reduction in their pain and improvement in their function of that joint. How we would give radiation depends on where we want to treat. And so shown here are various immobilization devices that we will utilize to treat a patient. So shown here, for example, we may make a mask that will fit over a patient's head, neck, and shoulders to help immobilize the shoulder, to treat the shoulder if that's affected. If the elbow is affected, we may use something called a vac lock bag where the arm may sit on it, and then we could use that to treat the elbow. And lastly, we could use something such as the mask shown here in panel A to immobilize the hands and feet. So you can see here there is a set of hands right here, and that will hold the hands still while we deliver radiation treatment. One example I like to discuss is an Olympic sprinter. His name is Usain Bolt, and he's considered the greatest sprinter of all time, and he's won 8 gold medals, including 3 at the 2016 Rio Games. And shown here is a screenshot from a Netflix special that he had called I Am Bolt, where he developed a tendonitis condition, and he flew all the way to Germany to receive the same exact radiation therapy that we were discussing. And then later, he then won the gold medal in Brazil in 2016, solidifying his role as the greatest sprinter of all time. So I often talk about this example because I think it's something that is worthy of mentioning of how effective this treatment may be if one may be affected by it. Now, one thing that we haven't discussed yet are what are the potential risks of radiation therapy. And this is something that's often discussed in the clinic when we recommend radiation therapy. There are a couple of things that the risk may be associated with, and particularly that's going to be how much radiation that we give, that is the dose of radiation, and where we treat on the body. For most conditions that we talked about in this lecture, the overall radiation dose is very, very low. So for most patients, they don't develop any side effects from radiation treatment. But there are some common risks, and these risks could include fatigue, where a patient may feel tired, or skin irritation if we're treating close to the skin. There's a theoretical risk of developing what we call a second malignancy, that is a cancer from the radiation treatment, although the actual risk is actually extremely low, but it's something that we talk about. And for majority of patients with the majority of conditions that we discussed, the benefit far outweighs the risk, and so for the right patient, we would recommend radiation treatment after a shared decision-making conversation with the patient. Now, there are some important notes. One thing that is important here is that for most patients, we do want a multidisciplinary approach. So when we talk about treatment strategies, it is important to not just consider radiation therapy, but that there should be a discussion with the primary care physician, someone in physical medicine, and orthopedic surgery so that a patient can have a well-balanced discussion on what is the appropriate treatment for them. All the radiation therapy we discussed here are considered medically necessary. And the last thing that I do want to mention is that for a lot of patients, radiation therapy is covered by most insurances. We do need to have authorization for referrals and approval of radiation treatment. But if there is any questions, feel free to contact us at CancerCARE at Titus at 903-434-4850, and feel free to reach out anytime if there are any questions or concerns or for an appointment. And we would love to discuss with you about the role of radiation therapy for the condition that you may have. Thank you so much for your time.